Do you know how facial pain feels like? Well, it varies from headache and nasal congestion to pain located in parts of the face, such as the eye, tooth, or jaw. Touching the area, chewing, lowering the head between the legs can make it worse. Now, there are 4 important questions that you need to ask your patient before making a diagnosis. Firstly, you need to ask the patient about headache, recent facial injury, anxiety, depression, fever, earache, eye pain, visual change, nasal discharge, toothache. Secondly, you should know that your patient or anyone in patient's family has had a condition such as diabetes, headache, migraine headache, nervous system disease, recurrent ear infection, rheumatoid arthritis, glaucoma, sinus disease, dental infections. You should know exactly where your patient is feeling pain on face. Now, one more important question you need to ask is about his medication history. If your patient is taking any medications such as diphenylhydantoin, ergot derivatives, codeine, aspirin, other treatments for pain, well, this is because this particular condition might be the result of adverse drug reaction to any of these drugs. Now that you are well aware of the symptoms of your patient, your main role starts here, because you have to examine the patient. Well, this physical examination includes temperature, checking teeth for hygiene and pain, thorough head, eye, and ear exam. Now, what can cause facial pain and what is typical for each cause? Well, there are 8 different causes of facial pain that you should be clear about: acute sinusitis, acute angle closure glaucoma, dental abscess, herpes zoster, tic douloureux, temporomandibular joint pain TMJ, chronic or acute otitis media, migraine headache. I'll be explaining these terms in a while. Now, if the patient shows symptoms like sudden facial pain, headache, nasal congestion, runny nose, and pain worsens when lowering the head between the legs, then this might give you an indication that patient has acute sinusitis. Do you know what is acute sinusitis? It's a sudden inflammation of sinuses. But if your patient has typical symptoms like sudden facial pain, eye is painful and red, headache, nausea, vomiting, blurred vision, then this might be an indication that patient has acute angle closure glaucoma. Do you know what is acute angle closure glaucoma? It's the sudden buildup of pressure in the eyeball. But what if your patient is having sudden tooth pain? Then this might be an indication that patient has dental abscess. Do you know what is dental abscess? So it's the collection of pus in the gums caused by an infection. And if your patient shows symptoms such as sudden facial pain begins before, during, or after outbreak, well, your patient is suffering from herpes zoster. Do you know what is it? So it's inflammation of the nerves in the spine and skull, causing redness on the skin. But what if your patient is having jabs of pain? Pain often occurs near the eye, may be brought on by cold, heat, or pressure over the trigger area. Well, your patient is suffering from tic douloureux, its nerve problem causing facial pain and spasms in facial muscles. And if your patient shows symptoms such as pain on chewing, sometimes history of rheumatoid arthritis, well, your patient is suffering from temporomandibular joint pain, it's pain in the lower jaw. But what if your patient is having earache, decreased hearing? Then this might be an indication that patient has chronic or acute otitis media. It's an infection of the middle ear. But if your patient has typical symptoms like throbbing pain, experience typical funny feelings before pain kicks in, headache often centers in the front of the head, nausea, vomiting, family history of migraine caused by alcohol or stress, then this might be an indication that patient has migraine headache. It's a severe headache. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required. That was all about the differential diagnosis of facial pain. Stay tuned to sqadia.com for more knowledge-stuffed videos.